My name's Jeffrey Miller. I'm a dermatologist at Penn State Hershey College of Medicine in Hershey, Pennsylvania. I've been there 13 years after training in Philadelphia at University of Pennsylvania. I have a passion for teaching, teaching both dermatology residents and medical students, but also teaching primary care physicians and clinicians about the importance of dermatology conditions. No, I was raised by a father who was a physician. I didn't know that I was going to become a physician, but when I saw how satisfied he was each and every day with his job, I think it planted a seed. And shortly into college, I realized that medicine was the right thing for me. And I've enjoyed every minute of taking care of patients, doing research, teaching in the community, and educating both medical students and residents. It's been a very satisfying career. I was interested in dermatology later on during my medical school training, and after each rotation that I would do in medical school, I would always ask myself at the end, is this something you can do for the rest of your life and be happy doing it? And when I did dermatology, at the end of my rotation, I knew that I could do this for the rest of my life and be happy doing it. And dermatology is a wonderful field because you develop relationships with your patients. You get to see patients of all ages, and it's a field that has a variety of procedures, and there's just many disciplines within dermatology. So it's a great field to be in. The hot topics right now are some of the new and emerging treatments, and we have a whole new field of treatments emerging that are called biologic agents, used for a variety of diseases like melanoma and psoriasis. So I think we're on the cutting edge of developing new and better treatments that are, number one, safer for patients, and also will hopefully cure, or if not cure, control disease even better. So the 5th edition of the book is an edition that makes it even better. It is new and it's unique in the sense that we've really focused, I think, on two major components. There's a new therapy section, number one, and the therapy section is broken down into what are the initial treatments, what are the common treatments for the common diseases that you will encounter in dermatology, and then we also have an alternative treatment section, and that's broken down for each disease in a table form that's easy to follow and that will help you take care of your patients. In addition to that, we focused on increasing the number of images, and the number of images have skin of all ethnicities. We realized that we need to make the images in the Principles of Dermatology, the 5th edition, represent the population at large better. So we have more images of skin of color, for example. And then in addition to that, we added a variety of new diseases as well as uncommon diseases, so that physicians, clinicians, when they read the book, are going to be better equipped to manage the most common skin conditions that they encounter in their practices. Principles of Dermatology stands on its own as an excellent primer for anyone who is starting a practice or is in the beginning of their career and wants to understand and treat patients who have dermatology problems. So it's an excellent primer in dermatology, and I really think that it really covers 80% of what you're going to see in a dermatology practice. So it's very popular for residents in dermatology programs to read this book initially. It's common in family practice residency training programs as well. So again, I'll just emphasize that again, it's a great primer, and it sets the stage, I think, for learning about the basics of dermatology.